We're going to start with the introduction of our new DHS Commissioner, Ms. Jodi Harpstead, and then Senator Abler has a few comments he'd like to make. So, Commissioner Harpstead, if you could join us and begin your comments.
Good morning, committee chairs and members of the committees. I have had this granite plaque which says trustworthy on it on my desk and the desks of our 90 senior leaders at Lutheran Social Service for the 8 years that I've been CEO. Not facing out to tell the world that we're trustworthy, but facing in so that every email and every phone call builds that trust. I'm taking it with me to the office at the Department of Human Services because there's nothing more important for the Minnesota Department of Human Services than to be trustworthy for the people of Minnesota. Trustworthy to people who depend on our services to live full lives in community, and trustworthy to the taxpayers of Minnesota whose resources we're entrusted with to use them properly, wisely, and effectively. I understand why you have given the department extra scrutiny with some of the issues the department has been dealing with this summer, especially around the issues of financial controls. It is also your job to be sure that Minnesota government is trustworthy for the people of Minnesota. Well, I've spent the past 3 weeks wrapping up my work at Lutheran Social Service. I have indeed thought about my 90-day plan, and it includes the following. Top priority, getting fully briefed on each of the well-known issues in the department, tribal MAT payments, the investigation in the OIG's office, chemical dependency provider payments, etc. I intend to press for completion of audits, reviews, and expect conclusions from those most knowledgeable about them that include the implementation of future preventative measures, and then an overall analysis of whether they point to systemic issues that need to be addressed at a higher level. For example, an early idea shared with me by Acting Commissioner Wheelock, we may need to consolidate and strengthen our federal billing function into one or more entities that can be even better at properly billing Medicaid and other federal programs. We did that a few years ago at LSS to ensure proper billing of our services to complex, densely regulated county, state, and federal programs, and I want to look into whether this could prevent future problems in the department. My other top priority, in parallel with the first, is to finalize an organization chart for the deputy and assistant commissioner positions, fill open positions, and build our senior team. Of course, the other commissioners of the Wells administration got the chance to build their teams in December and January. Now I have the opportunity to put together the very best team of leaders for DHS going forward. I can tell you that I've had conversations with the senior people who've chosen to leave and those who have stayed, and I support their choices as good, healthy decisions for themselves and their families. I will also share with you that my management philosophy is to build a team around a good diversity of people, some who have 6 new ideas before breakfast every morning, and some who are rock steady and keep the train on the tracks, taking great care of functions like financial integrity and employee relations. I'm looking for a diverse set of people with diverse skills and abilities that complement one another and who will work together well. The good news is that Minnesota is awash in talent in the health and human services space. I'm eager to draw more of that talent into public service in the department to join the talented people already there. I can tell you I've already had an outpouring of support, advice, offers of consulting services, and resumes from Minnesotans who want to see the department rebuild and move forward. One of the top qualities I'm looking for, not just in my leadership team but across the department, is a commitment to equity. Minnesota continues to have some of the deepest disparities in the nation, and human services play an important role in solving those. I believe strongly that by continuing to push forward with an equity lens on all that we do, we will improve outcomes and increase opportunities for all Minnesotans. In addition to filling open roles in the department, I am open to the conversation about the merits of separating parts of the department, especially the direct care and treatment area, from the rest of DHS. By doing that, though, I'd want to be really sure there aren't any unintended consequences that I'm not yet aware of, and I envision a good discussion about that with stakeholders in the legislature. My third priority is to build key relationships and do lots of listening to a variety of partners and stakeholders, particularly with the tribes and the partners we've had strained relationships with this summer. My staff has me on a dizzying tour of meetings, phone calls, and trips to connect with people receiving services through the department, legislators, tribal leaders, counties, payers, providers, advocates, community partners, and other commissioners. I'm going to have to ask for patience from people who'd like to meet with me, as I have many things to do and the two top priorities to tend to. My fourth priority is to continue to drive the innovation that has brought in billions of dollars of savings through the kind of payment reform that has been led by the department's healthcare administration in recent years. Over the summer, the department has also received an innovation award from the Humphrey School for an online employment resource for people with disabilities, launched a new housing benefit for seniors and people with disabilities, received federal approval for a program to better serve Minnesotans with substance use and mental health needs, and I could go on. We're at an exciting time in our nation's history as we all come to grips with caring for the huge aging baby boom, as well as others who need support to live in community. I've been working with DHS for the past 5 years to develop the Altair ACO for people with developmental disabilities in community services, and I remain committed to exploring new data-driven approaches that promise to lead to better health, fuller lives, and lower cost, in that order, for all Minnesotans. We're also in a time when other states have tried approaches before us, some that have worked and some that haven't, and I'm eager to have people at DHS stay in touch with and learn from those successes and failures. For example, the subject of today's hearing on county-based purchasing makes me want to see what we already know or can learn about healthcare purchasing models in other states. The people of Minnesota owe a deep debt of gratitude to Acting Commissioner Pam Wheelock, whose very steady hand on the tiller has kept the work of the department moving forward this summer while addressing the issues that have arisen. I know I do. I'm grateful to Governor Walz for expressing confidence in my leadership with this appointment. The theme of my 90-day plan is to rebuild the department in order to rebuild trust with the people of Minnesota. I'm counting on your support through the next 90 days, and I'd be happy to answer a few questions before we move to the subject of today's hearing.
Senator Abler.
Well, thank you, and thanks, Commissioner Harpstead. I'm not used to calling you that. I'm actually pleased. Well, actually, I said this to everybody. I was happy that Commissioner Laurie was there. I thought he would have been good. I was pleased that Interim Acting Commissioner Wheelock was there, and I hope this is a good thing to tell you. I'm glad you're here, so we'll see how that goes. You know, we're all really frustrated and really disappointed in how things have gone, and I appreciate the tone of your comments today that differ from Ms. Wheelock's when she came, and there are good things that go on. And we know that there, and you left it implied that many, many good things happen. And I just want to single out in particular two groups of people at your department. There's a line. There's people who you get to hire that are appointed based upon who comes and goes at the top, and then there's a rank and file people who made this their career. And I agree with one thing you said on Almanac, that those individuals are really having a hard time. Some of them have reached out to us. Individuals have called us, and they talk about their interest in doing a good job, but their inability to actually report things that the OIG didn't care about taking their fraud complaints. Did not care. And like, oh my, that's the above the line people that didn't care about the below the line people, and we can't have that. And I hear that clearly in your comments, that is unacceptable. And I'm happy to hear that and so I think that you have the control of the above the line people, and there's a lot of fine people there. But I think there's some ones that aren't doing the work you think they are, that aren't as open to innovation, that aren't reaching out to their middle managers, who are craving the opportunity to tell you how we can do better. They live there every day. They're going to be there as a careerist. They've elected state service, and they've deferred higher income opportunities for the service and what benefits and joys the service at state level can be. And I wanted to make a point to commend those individuals, who many of whom are just nervous. And as we talk to them, they're afraid to give me their name, just so you know. And I'm just saying that. Mm-hmm. And so we'll talk about restructuring. I believe I had a hand in getting this report crafted about direct care and treatment. I'm pleased that Commissioner Wheelock took a moment to point out this. And I'm a fan of protecting every worker here. There's no point in thinking as we redirect the direct care and treatment into be a separate thing that it doesn't make sense that the regulatory arm actually does service. But they can actually have more freedom, and I think they would like that. And I think, frankly, the OIG does not serve you well, does not serve Minnesota. I think it serves the department really well because there's all these internal compressions that go on their ability to do work. And I think as we read the auditor's report that it's just functionally impossible to keep it there. And so we'll work with that. I'm just offering you a continuing challenge. And I do think you have some rebuilding to do. And I'm glad it's you. And I don't think you need a plaque that says trustworthy on your desk, because I think trustworthy is inside of you. And I was disappointed with Commissioner Wheelock, who I just think has been a stellar public servant, that she was so hamstrung and reading speeches written by a staffer who came on board for purely that purpose. I think we're moving beyond this. This is a speech that comes out of Jodi Harpstead. And I think Minnesota needs you to be you. And I've told you this privately. I told you it just again this morning. I'm telling it to the audience so that perhaps everybody who is dealing with you realizes that your charge, at least from me as just one member out of 201, is eager to see what good can happen. We have our hands full. And I'm going to just say a couple more things. The legislature and Department of Human Services, they are, in some world, they're partners, but not really. DHS does what it does. They come and endure the legislature and get us talked into doing whatever ideas they've got. Listen to a few ideas, say no to most, and go on. And at the end, and some of those ideas come from middle managers. And as a result, the service suffers. The people that we are all here so dedicated to, not partisan in any way, suffer. And so I just encourage you to find a way to rebuild the partnership with each of the members who are here and those that are in the other body, anybody who can. And that's a tall task. So we'll talk more. And in these comments, you've heard some concerns, some encouragement, and hope for the future. And that's why I fully intend to be here for my share. And I just wish you the best in this most daunting of tasks. So thank you very much.
Thank you.
Senator Kiffmeyer.
Thank you, Madam Chair. Welcome, Commissioner Harpstead. We appreciate your being here today. And to all of those who take on these kinds of roles, there's a lot of work, a lot of opportunity. And so we're always grateful for those like you who have stepped up in these kinds of situations. We appreciate that. One of the things I thought of, though, as you were talking, that you are new to DHS, but in fact, you're not so new because of Lutheran Social Services. And I know you had a lot of work there. But the big thing is that we also are not new. Mm-hmm. Those of us here at the committee table are not new at all to either DHS or to the long-going series of problems that are within DHS. And this isn't just the most recent or the only one. This is the one in a very, very long series, including that court case. The big thing is with responsibility and opportunity, the big thing is there's talk about above the line. And so I think the question for me is, there's two of them. One is above the line becoming a wall, where your own staff, I suspect there's some folks there who have some really good ideas, but they can't get through. They can't get above the line, or they fear that if they do, there would be consequences that would be unpleasant for them. And I think it's really important to not shut them out, but to welcome that, and it may be unpleasant. It may involve change. The other thing is the other potential of the wall between the legislature and DHS and the governor, who has ultimate responsibility. As Senator Abler has talked about, we want to be helpful. We have a job to do. You have a job to do. The governor has a job to do. But we want to be part of that and help you in regards to that. But if that hand is put out that says, keep away, We've been here. We've been on this side. Specific question I have for you, though, Commissioner, I know this is early in your term, but I think this is the time to deal with it. I'm grateful for your work in the Lutheran Social Services, but there are a lot of contracts within DHS with Lutheran Social Services. That's a potential conflict of interest, and I think it's really important for us here in the Senate to find out how are you going to handle that potential conflict of interest? What are you doing within your own agency in regards to that?
One of my first meetings this week is with General Counsel so that I can understand how to draw a bright line between myself and Lutheran Social Service of Minnesota. And I just need to understand some strategies to make sure that we do that, and we handle that very, very carefully. So I'm going to make sure that we completely put together the right approach so that we don't miss a mark on that one.
Thank you, Madam Chair. I appreciate that response, Commissioner Harpstead, and we'll look forward to hearing more from you and to working with you.
Thank you.
Senator Matthews.
Thank you, Madam Chair, and thank you, Commissioner, for being here today. Congratulations on your new appointment. And I know on your first day, I'm sure there's a steep learning curve ahead of you, but thank you for stepping up to take on this difficult task with the agency. I would just want to give you some feedback from myself as I've been throughout my district this summer, whether at a county fair or meeting with local officials or meeting one-on-one with constituents bringing issues before me. It's come up over and over again with people asking me, what in the world is going on at DHS? And I'm surprised by how many times this comes from everyday Minnesotans who aren't in the political world on a day-to-day basis, but those that are hearing repeatedly of what's going on and are coming up expressing concerns. And my answer usually has been simply to say, I don't know, because we're not getting any answers. Chair Benson has pointed out recently in an editorial how it appears that the agency has lost either by error or fraud in the past few years about $300 million of taxpayer money. And you know the list of all the issues that have come up, eligibility issues and written off premiums and CCAP fraud and overpayments to our tribal governments. Resignations, unresignations, re-resignations, the list has been long enough that it's eroded public confidence to the lowest levels that I've ever seen. And so this agency, I've reckoned to like a patient at the hospital, and this patient has some serious symptoms that have just been mentioned. And so these symptoms need to be properly identified so that we can give the proper care and treatment to get this corrected and get back on course. And I understand that earlier you've stated the desire to move on and get past this so we can all focus on the good things that are being done. I'm grateful that your testimony this morning changed in the direction of recognizing there are serious issues that you want to tackle head on. And I hope that your actions will then match out what you've shared with us this morning. Because just as it would be irresponsible for a doctor to tell his patient, let's just ignore these symptoms and focus on the good bodily functions that you have going on, it would be irresponsible to do the same at the agency. So I'd like to point out probably the three biggest issues in my mind. Would encourage you to be able to give substantive answers to legislators about mistakes as they occur. I thank you for taking a good, strong first step with that this morning. Make members available to testify if we need to continue with more questions. And I will highlight again, do not take any punitive steps against whistleblowers or people that have pointed out where the agency is following statute. Instead, the behaviors of the agency should change their practices to conform to the law. And with these, with some of these simple points, I'm sure we can go a long ways in trying to rebuild the confidence in this agency, and we can go back to working together for the good of Minnesotans. Thank you.
Thank you.
Members? Commissioner. First of all, thank you for coming in with an articulated list of priorities and things that we can look for and measure and support. I don't think there's anything on this list that these committees jointly can't fully support. I hope that you are empowered by the strength of the governor standing behind you to go in and execute, particularly the audits and the systematic review of how funds are handled. That has been, I think, the most problematic and troubling to Minnesotans over the last several months. I appreciate that you want to rebuild the department so you can rebuild trust. There are so many places that trust has been broken, as Senator Abler mentioned. Employees have been reaching out to us in all sorts of convoluted ways, Facebook messages. They're trying to be anonymous because they're afraid. And so they give you enough information so that you have some veracity to what they're asking you to do. But there's something wrong when people are afraid of telling the truth. And so I am so grateful that you have this list of priorities, but an employee culture where people are afraid is not going to lead to a productive agency. You know that. I would encourage you to make one of your earliest appointments with Auditor Nobles. He has auditors inside DHS, and they might see things differently than the people you're with every day. Yep. I think you might feel more empowered seeing things from a 360 view. I know you're talking to various stakeholders, so I would hope that you would put him high on your list.
He's on my list. Thank you.
Excellent, excellent. And if I'm higher than him, he can have my slot. I don't care. But he has a perspective that none of the rest of us can have because he's inside and his team is inside. For me, I want a department that serves Minnesotans and respects taxpayers. Those are the two things that I would measure. And so you will have our support in the items that you brought in today. I've worked with a lot of executives. This is exactly what I'd expect to see on day one from somebody with your experience. And with that, I want to thank you for your time. If you have closing comments or if Senator Abler has anything else to add. But otherwise, we thank you for your time today, and we'll move forward with the hearing.
Just a couple comments. I believe that I have a good track record, both at Medtronic and at Lutheran Social Service, of creating a good culture of trust, especially between above the line, below the line, the home office and the field, however people come to work, characterizing those kinds of sort of natural issues. And so I very much hope to bring that. We had a good conversation already yesterday with senior leaders about reaching to frontline employees in better ways to have communication and conversation. I would also say that several people, including here this morning, have congratulated me, they think, on taking the toughest job in state government. But I would also add that I've had a lot of outreach from former commissioners and assistant commissioners and people who've worked at the department over the years who've reminded me of the truly marvelous work that we get to do at the Department of Human Services. And that is the job that I'm excited about starting this week.
Thank you very much, Commissioner. Oh, Senator Nelson.
Thank you, Madam Chair, and I'm sorry we went to closing comments so quickly. I didn't get in a very brief comment and a question for the Commissioner. One, I'm reminded of the challenge that you face, and I do appreciate you stepping into a hard place for a very important job. And my one brief question, my constituents, what I have heard over and over is they want to know these overpayments are all the other symptoms and issues that Senator Matthews mentioned are a great concern. And we anticipate that there will be safeguards put into place so those type of things don't happen again. But the lingering question is, who is going to pay the feds back? So we can't recover the fraud that had been in other areas, perhaps, but there is this lingering bill coming to Minnesotans from overpayments from the feds because of the billing that was suggested or guidance that was given to the tribal nations and other providers. And so the question is, who's going to pay for that? And how much are we talking about? How long has that overbilling been going on? And we know there's the way to stop it, but how long has it been going on? What's the total amount? And who's going to pay? Where's the money coming from?
Yeah, that's a very good question. I have the same question. I've just begun to get briefed on that issue, and I need to learn more about it. Of course, we're waiting for the review of the whole situation to really get the entire picture of it so that we know exactly what you're asking about, how far back, how much. And then the question is, what are the potential pathways going forward? I reached out yesterday to both the White Earth Tribe and the Leech Lake Tribe, and we had cordial conversations about how we all want to see this resolved in a way that's not harmful to the tribes. And I need to go and understand more thoroughly what possible pathways there are for us to reach that outcome, and I don't completely understand yet what's possible. And we'll want to be talking with all of you about that as we go forward.
Thank you. And one final comment.
Senator Nelson.
The taxpayers, yes, the tribes, but the taxpayers.
Yes, absolutely.
The taxpayers are on edge. They want to know, how is this going to be handled? So thank you.
Thank you.
Thank you. Senator Abler, final comments?
Well, actually, so we've had here we are, we've had really a nice hello time here, and so we've had our glass of wine, and now I'm glad that Senator Nelson asked a question about some content, and I realize you're not prepared to discuss a lot of content, but as we look forward, I do have a wish list of a few things I just wanted to send you off with. On topics like the $25 million and the $48 million, it seems, I believe you'll be changing this, but historically, the amount of information that has flowed out of DHS to us has been the smallest bit that can be given, it seems like. I raised 6 teenage sons, and what happens sometimes is they run into a curb or something and dent the fender, so they park the car so you can't see it. But
I've had teenagers too.
But they never happen to anybody else here. But eventually you find out. And as you work to rebuild trust with us, some more comprehensive information, like the $48 million piece on the IMD. I found that out from a reporter who had read it in an article, which is not really how you want to disseminate your information. And you will find from us a much more forgiving attitude if you come up with, and I still haven't seen the list of the affected sites. And I wanted to point out that the sites didn't get any money that they shouldn't have gotten. They were feeling that they were dinged for being like stealing $48 million. And the tribes didn't do anything. They didn't take anything that wasn't theirs. They were told to do these things. Now we have these accounting problems. And I didn't know that it's fixed forthgoing. As I talked to one person who ran across me at the fair. And so a purposeful, intentional content bit of information that you would give to your senior managers is the least that we should expect from you all on that. And that has not gone well for a long time. This goes beyond any administration, but I think you knowing what people would want to see having sat on the outside, wishing you know some stuff, I think that would really, really help. And if there's bad news, let's hear it from you. And I think you'll see the quotes will be a little friendlier and as we go forward. So I just wanted to bring that up. So now that's your homework assignment or as you work. But I do wish you the best, and your success is really important to Minnesota.
Thank you. I appreciate it.
Commissioner Harpstead, anything further? No. We appreciate your time this morning, and we will be in touch soon. Thank you. Oh,
Senator Benson.
I'm sorry. I had a couple more folks. I didn't realize Senator Hayden.
Good. Well, thank you, Madam Chair, and thank you, Commissioner, for being here. We had a chance to chat a little bit yesterday, and it's just something that I actually want to reiterate is I think that our ability to have solid communication and obviously not hear things from the press that we hadn't heard because we don't then know the context of that. I think that is important, and I'd like to just say that maybe broader and loudly to not only you, but the folks that work for you, hopefully you create an environment where they feel like that they can have these conversations with you and with your senior leaders of your team and be able to kind of work through those things so that we know together how to move forward. But I think it's going to be awfully important that I know that if people feel like that they're not heard, then there's various ways that they can be. But hopefully this is a new day and people can be heard, and then those issues and those questions can be answered in a way that's really helpful to Minnesotans, helpful to the taxpayer, as opposed to you having to continue to come in front of us and try to work from behind and play defense on this issue. We can actually get the answers to these questions. I, like the chairs, we worked on the IMD issue. We put money towards the IMD issue. We worked on we all probably had a little piece of that legislation that put together the criteria or what we were going to do for the waiver. We spent a lot of time on that. So when I heard that there was issues still going on, I still don't have all of the answers. As I talked to your staff, I still don't know what's going on and who's affected and why they're still affected, because we worked on the issue. So it wasn't something that we hadn't worked on. It was something that we had worked on, and then there was a problem. And then somehow within the department, it was the idea that we should go to the press as opposed to work through the cycle. So you're new, you're here today in front of us, and I just wanted to not only thank you for taking on what is going to be a pretty big job, but I'm also hoping to give an invitation to those that work inside of the department that hopefully we can start working much better together.
Thank you.
Anything further, members? Commissioner? I will echo what he said. The sooner we hear bad news, the less likely. I would much rather say to the press, yes, they told us, and here's their plan, than no, we didn't know, and now we have to figure it out. So I know that you're working to build trust. That will be a key part of it, and I thank you for your time today.
Thank you.
Thank you.